You're listening to the We Are Libertarians podcast network. Find all of our shows at wearelibertarians.com. Welcome to Now Hear This. I'm your host, Chris Spangle. Now Hear This is a conversation with leaders in Indianapolis that are working to improve the lives of Hoosiers. Our goal is to empower you to join in their work and make a difference while informing you about the unseen aspects of life in Indiana. If you miss an episode, you can now listen via podcast at nowhearthisindy.com. I am speaking today with Ben Harvey, who is the CEO of Indiana Primary Healthcare Association, of the Indiana Primary Healthcare Association. I would imagine, Ben, that it's probably a busy time for you and your association, is it not?
It is a wildly busy time for us and the community health centers across the state of Indiana.
Well, let's start with who you are, what your organization does. What is the Indiana Primary Healthcare Association?
The Indiana Primary Healthcare Association is a member association for the 35 federally qualified health centers and federally qualified health center lookalikes, which are also known as community health centers here in the state of Indiana. So we represent them. We provide them with education, training, technical assistance, and collectively those health centers serve around 600,000 low-income, vulnerable Hoosiers in the state of Indiana.
Okay, so tell us what a community health center is for those of us who don't know.
Sure, yeah. So a community health center is a primary health care clinic. So they provide outpatient ambulatory primary health care in medical, behavioral health, and dental services to underserved populations in the state of Indiana and across the nation. Across the nation, they serve around 30 million low income or uninsured, underinsured, underserved Americans. Here in the state of Indiana, we serve about 600,000. But they're community driven, so the boards of the CHCs have to be made up of at least 50% of patients. So you have to actually be receiving services from that clinic. They're meant to be community-based services. They're meant to receive anybody regardless of their ability to pay. So people that are uninsured or on Medicaid are welcome to come in at any time. And they're, again, driven to serve and provide primary health care services. So we have them in Indiana from, I've heard someone say, from lake to river. So from up in the far northwest to the far southeast. So they're fairly ubiquitous.
So when you talk about the most vulnerable Hoosiers or people needing care, who are some of the people that show up to those community health centers? What does that look like? And maybe the better way to phrase this is, if someone is listening right now, how do they know if they qualify to visit one of these health centers?
Yeah, so there's really no qualification. I mean, anybody can come in. They accept anybody, again, regardless of their ability to pay. They generally end up serving. They're designed to reach populations and reach people who otherwise may not be able to access care. So there's a federal partnership that goes along with the community health center model generally, in that you receive federal dollars to support efforts in providing primary care services to underserved populations. So again, the doors are open to anyone, but you're generally going to see populations that are unlikely to access care through other mechanisms. And most of the health centers here in the state of Indiana have long histories. So HealthNet here in downtown Indianapolis, they've been serving since, I believe, the late 60s, early 70s. And a lot of these organizations grew out of very localized need and then have just gradually grown beyond to serve more and more patients within their broader communities. So yeah, again, the doors are open to anyone, and generally there's not going to be slapped on the side of the building, "This is a community health center." They're going to go by names like HealthNet, Eskenazi Health Center, for example. The HealthLink up in Northwest Indiana. They have their own organizational names, but the CHC, the Community Health Center, is just generally a trade name, a trade designation that we go under, which is similar to the word hospital. Hospitals, it's got a defined form, but you're not going to necessarily call it a hospital. You're going to call it Parkview or community or something like that. That's similar to community health centers in the state of Indiana. So again, they serve about 1 in 5 Hoosiers who are on Medicaid. They serve a lot of low-income communities. They serve a lot of racial and ethnic minorities. Of the 600,000 patients that community health centers serve, a little over half are racial or ethnic minority. So serve a large number of folks in the African-American communities here in Indianapolis area and also up in the region, especially around Gary. So it's a pretty diverse group of folks and very committed to the idea of serving the underserved and providing high quality primary care services to patients.
Is it just, when I think of healthcare, I think in the listener's mind, my mind, you think checkups, I'm sick, I need antibiotics or whatever. But when you say care, what are the range of services that these community health centers cover?
Yeah, so it's primary care. So it's tip to tail primary care. So you're going to do anything like you just said. They're not like minute clinics or quick clinics or urgent care, though some may have some urgent care facilities. They're really designed to be that medical home for folks. So taking care of someone from birth to death. So taking care of patients, pregnant moms, taking care of little kids, taking care of older adults across the spectrum of needs. So that's what they're designed to do. They're also designed to connect you to resources you may not otherwise be able to. So it's not just, we know that the individual's health is not just confined to the healthcare services they receive. It's confined to, it's affected by other areas like transportation. Do you have adequate transportation? Do you have a job? Do you have adequate housing? And health centers are designed to be able to treat and deliver services to the whole person, not just necessarily what can occur within the clinic's walls, but also to connect to resources in the broader sense. And that's really the design. The design of it, again, is to be based in a community, not just from a typical physician-patient relationship, though that's one of the primary things that they do, but also to provide services to the broader individual's needs.
Be it oral care.
Absolutely. Behavioral health. That's exactly right. Yeah. These are things you can't separate someone's brain from their body. That's indicative of the model that health centers have. So yes, so access to dental services as well. Typically that's done, dental services in the state of Indiana, the vast majority are done by individualized dentists, and the health centers are trying to integrate that piece into the medical services and behavioral health services to be able to treat the whole person. So,
obviously we're in the middle of a pandemic, and I have talked to some people who think for whatever reason, I was talking to one friend and she said, my son's black, he can't get medical care. They probably would turn him away if I went to the hospital. And I said, I don't think that that's true. So can you help me speak to that? Because, I think there's a lot of people who are uninsured who often think I can't get care. Or they think I have these symptoms, I can't go to the hospital. I mean, it sounds like what you're saying is the exact opposite.
Yeah, that's true. I mean, so I wouldn't want to wipe away the long-standing inequities that African Americans have faced in the state of Indiana and across the United States. And myself, growing up in a smaller rural town, Fairmount in Grant County, it's difficult when you don't have a local hospital or you don't have a local provider accessing services. And I can understand some of the barriers that folks face. And that's the thing about the pandemic now that we're facing, is that you're seeing the inequities that were already in the system and the failings of the healthcare system in Indiana and in the United States. They just get exacerbated by something like this. And so I can understand the hesitancy, but certainly from a community health center perspective, our doors are open to anyone, regardless of race, ethnicity, ability to pay. There are providers out there. I know of no hospital in the state of Indiana that would turn you away based on race, or really ability to pay based on the situation that we're in. We have a good working relationship with the Indiana Hospital Association, and they're pretty focused on taking care of every Hoosier. And so I would say, if you need care, certainly you're welcome in a community health center, and you're welcome in a hospital across this state. Don't be afraid to go in and get care. Don't be afraid to reach out to a provider. You're not going to get turned away in this sense.
Speaking to Ben Harvey, who is the CEO of the Indiana Primary Healthcare Association. You're listening to Now Hear This. I'm your host, Chris Spangle. Obviously, with the pandemic raging, the need for care is immense, and I imagine community health centers are on the front lines like most hospitals are. My mom is an RN, and she's out in Hendricks County. They're obviously being hit hard. I mean, so what is being done differently at a lot of the community health centers to help fight the pandemic?
Yeah, I mean, so one of the big things is telemedicine. We're seeing big implementation, big increases in the amount of folks that are using telemedicine. The state of Indiana has done something that I think is pretty beneficial. So it allows telemedicine to occur similar to this right now, where you're seeing someone virtually, or also at the same time, you can do it over the telephone to connect to your doctor. So we're seeing some really nice policy changes that are opening up doors that may not otherwise be open. And we've seen providers, increase the amount of telemedicine visits they're doing by 2 or 3 times. And I think it presents a great opportunity when you're being told, stay home, don't leave, isolate yourself in your home, except for essentials. There's a lot of fear that goes into, so for example, I have a young son with Down syndrome, and he had an accident in the last week or so, and he had injured his lower leg. And there was real fear as to how we're going to get that taken care of. If you take a kid that has immunocompromised state and you put him into a hospital, there's real fear there. My wife and I had to make a decision that wasn't easy to make. We eventually had to take him in because he had to get an X-ray. But I can understand folks' fear with that. If you're in a compromised situation, I can understand the fear of leaving your house. So something like telemedicine, which is what our health centers are really buying into, and I know a number of hospital systems as well in the state are, it's a great way to connect to your provider, because your diabetes doesn't stop, your asthma doesn't stop, any of the health conditions that you have, they don't stop because of a pandemic, because of COVID. So this is a great way to connect to your providers. And if you need to reach a provider, I think it's a great mechanism to establishing a relationship that's going to exist, hopefully beyond just the pandemic, to address needs that you have now and also address needs you have.
And I'm not going to lie to you. I'm somewhat of a hypochondriac. And so when all this started and the allergy season was beginning and I was a little worried, we just interviewed the pathogens unit at IU Health, and she told us about their app, the IU Health app, the virtual screening app, and I called it totally free. She helped walk me through it. I won't discuss my personal details on the air, but yeah, I think that to me was a great comfort, and it was free, and it was super easy to use.
Yeah, I agree. I think it's a really easy thing to do. The interesting thing is too, we've seen there's the provider side where the providers are trying to do it, but what you just described from the patient side, everybody I think is now into the idea of trying to connect. So the barriers that you would classically assign to technological adoption, something like, hey, older folks aren't going to use this. I think there's a lot of benefits to it. And really, I think long-term benefits, like you just said, when flu season comes around next year, if your doctor is able to connect to you virtually, why not do that? And instead of going into the clinic to get checked, I think there's some real serious benefits to it. And I think health centers are seeing that, patients are seeing that. I think the system's going to see this. The system, in air quotes, is going to see that long term, and I think this is going to end up becoming a more accepted mode of delivery of healthcare services and receipt of healthcare services. Another
thing that's out there that I've seen a lot of is, the numbers of the COVID deaths are overinflated. That if you get in a car accident and you die, then they're going to mark you as a COVID death. Can you walk us through the process of somebody who unfortunately passes away from COVID, is marked as a COVID death? Who makes that decision, and can you speak to that a little bit? Kind of clarify for those of us who are not really sure how these numbers are actually calculated.
Yeah, that's a great question. And I know, Dr. Box at the state would be able to speak really well to this, because they keep the birth and the death records, and they manage all of these things. And they're not managed, it's not as if you're sent into a black box or some random person off the street makes this decision. We're used to work for the Missouri Department of Health and Senior Services, and in the public health field, this is an area of intense focus and clarification, trying to manage death records and find out how someone died, all those types of things. So I want to say that it's not always crystal clear. But that being said, the person that marks on your death record how you died is generally not someone who, again, has no concept of what's going on, right? And so it's generally a physician. It may be a county coroner in some instances. This is someone that has some knowledge and is making the best judgment that they can make at that time based on how you died. So it's not, again, this isn't some politician coming in or someone that is obviously trying to benefit from inflating numbers, though I'm not quite sure how anyone benefits from inflating numbers right now. It just doesn't seem conceivable to me. Also, too, the thing to remember here is that there are probably a great number of folks here that are dying of COVID-19 or maybe potentially having some of those issues that are just unknown. Don't have a diagnosis because testing is not as widespread. So the numbers, not to sound scary, the numbers may actually be higher than what they otherwise look at this point, because we're not testing as frequently or as widespread as what we otherwise could have been. So I would say, again, I don't think there's any any reason to drum up a conspiracy theory based on the number of deaths from COVID-19. I think there's there's no hoax. There's no driving political force behind this. No one's winning from folks dying of COVID-19, and the decisions around someone's death and how someone's died is not done by folks who have no idea what they're doing. It's typically done by experts, typically done by physicians, by someone who's either treated that patient or knows that patient. And then that is taken into the State Department of Health and managed and then reported on. So again, I feel confident in the numbers that we have, and I don't see any indication that someone's trying to, again, win something or make this a bigger story than it otherwise isn't. I don't see any indication of that.
So why do you think that this hits people with pre-existing conditions? Why is it, what about the disease exacerbates some of those other things? Why is it hitting people with diabetes and high blood pressure harder? Do you know that?
I don't. I wouldn't want to speak to that aspect of to the physiological aspect of it. From a social aspect of it, though, I can certainly see where it is. If you're, if we're seeing across the nation, and I'm not sure, I haven't seen the state of Indiana has released any demographic information beyond age and location. But typically people with pre-existing conditions or individuals of color, racial ethnic minorities, you're typically going to see higher rates of uninsurance. If they're in a rural area as well, you're typically going to see lower access to healthcare services. So you're taking someone that's already vulnerable and exposing them to a disease that we don't have a solid treatment for, that is moving very fast. You can see, I think, to a great degree, if you already have vulnerable populations and you expose the whole population, everybody in the state, to a virus like this, the individuals who are going to face the brunt of it are the ones that are vulnerable. I think you see that obviously with nursing homes. You see that with minority populations here in the state. You see it to some degree too with rural populations. There were some issues down in Batesville, I know. So yeah, that really is the driving force from a social perspective. From a physiological perspective, I'd leave that to someone that's far better trained and capable than I am with that. If you've talked to somebody at IU, I'm certainly not going to jump on.
We'll have people go to their local community health center and ask that. So final question is, what do you see every day that you just wish people understood better?
Yeah, that's a great question. I think the answer would be that the thing I see most frequently now is that people need to maintain that connection to their primary care provider. So we're seeing a lot of people stay away from clinics. A lot of people not want to come in. Exactly to what my personal situation is and what you said as well, Chris, is that I think there's a real fear, and rightfully so, of coming into a clinic, coming into a hospital, coming into a community health center. So know that there are options available. That's what I would say. There are ways to connect virtually to your physician, and know that the issues that you face are not ones that go away just because there happens to be another virus on the street right now. So I would really encourage folks to make those connections and utilize the resources they have available. As well, what you spoke about earlier, if you're in a situation where you don't have insurance or you don't have typical access to care, there are providers that are there. The community health centers around the state of Indiana, again, from the lake to the river, they're there, and they're willing to accept you as a patient and to provide you the services that you need. So don't be afraid, and don't think that there isn't care available, because there certainly is.
If people want more information on the Indiana Primary Healthcare Association, where can they go?
They can go to our website, so indianapca.org. Again, indianapca.org. Our website's there, and we also have a function on there that has a find a health center. So if you're interested in finding a local health center or what services may be available, you can type in your street address, and it'll pop up local health centers that are close to you.
All right, Ben Harvey, CEO of the Indiana Primary Healthcare Association. Thank you so much for joining me.
Thanks for your time. Appreciate it very much.
Thanks for listening to Now Hear This. I'm your host, Chris Spangle. If you missed any portion of our program, you can listen on our website, nowhearthisindy.com. If you'd like to have your organization featured on the show, please contact Gabby at 317-475-7407 or via the contact page on our website. Thanks for listening, and we will be back again next weekend with Now Hear This.
Was America founded on oppression? Or have we always strived towards a higher ideal? This is Caleb Franz, host of Profiles in Liberty. and I am very excited to let you know that the second season of the podcast is now airing. Every Thursday, join me on a journey of discovery as you hear about the men and women who fulfilled the promise of 1776. Season 2 of Profiles in Liberty, The Equalizers, is now airing exclusively on the We Are Libertarians podcast network.